Welcome back. I'm Dr. John Knab, and today we're talking about something a little different, low-dose naltrexone, or LDN, and how it might help people dealing with chronic nerve, muscle, or inflammatory pain. If you're someone who's tried different pain treatments but still struggles with symptoms, this might be an interesting option worth considering. If you find this content useful, please be sure to like and subscribe to our channel for more valuable information on how you can manage your musculoskeletal and nerve pain without surgery. All right, so when people hear naltrexone, they often associate it with addiction treatment, which makes sense because at higher doses, naltrexone is used to block the effects of opioids and alcohol. But what many people don't know is that at much lower doses, typically between 1 and 4.5 milligrams total per day, which is extremely low, naltrexone acts in a completely different way, and researchers have been exploring its potential benefits for chronic pain, autoimmune disorders, and even conditions like neuropathy. LDN works by temporarily blocking opioid receptors, which might sound counterintuitive for pain relief, but what happens next is fascinating. Because of that brief blockade, the body actually increases its own production of endorphins, which are natural painkillers. It also seems to have an anti-inflammatory effect, particularly in the nervous system, which could be why many people with chronic pain conditions like neuropathy, complex regional pain syndrome, and even autoimmune-related joint pain report significant improvements. One thing that's really important to understand is that LDN is not a narcotic, and it's not addictive, and it doesn't work like any other traditional pain medication. In fact, it actually blocks the effects of opioids, which means if someone is taking opioid painkillers, they typically need to stop those medications before starting LDN. Since it's non-addictive, it may be an interesting option for people looking to avoid the risks associated with long-term opioid use. Now, if you're thinking that a higher dose would work better, that's actually not the case with LDN. In fact, studies suggest that the usual more is better approach does not apply here. In some cases, higher doses can even be less effective than lower ones. And this is why many providers start patients on a very low dose and slowly adjust only as needed, rather than jumping to the maximum dose right away. This type of low and slow dosing may seem funny, but it's one of the unique aspects of this treatment. Over the past few years, there's been even more research into how LDN works and who might benefit from it. A review in 2023 looked at its effects on chronic pain conditions like fibromyalgia and complex regional pain syndrome, confirming that many patients experienced meaningful pain relief and improved quality of life. Another study highlighted how individualized dosing is key. What works for one patient might not work for another, so it's important to work with a provider who understands how to adjust the dose properly. Beyond pain relief, researchers have been investigating the broader effects of LDN on inflammation and immune function. Some studies suggest that it may help to regulate the immune system, which could be beneficial for people with autoimmune-related pain conditions. While it's not a cure-all, the fact that it works through multiple pathways, boosting endorphins, reducing inflammation, and modulating the immune response, makes it a really interesting option for people with chronic pain. So, who should consider LDN? It might be worth discussing with your doctor if you haven't been experiencing nerve pain, muscle pain, or an inflammatory condition that hasn't responded well to other treatments. In general, LDN is really well tolerated, though some people experience mild side effects like vivid dreams, mild nausea, or temporary sleep disturbances, especially when first starting out. These symptoms tend to resolve as the body adjusts. If you're interested in trying LDN, it's important to work with a knowledgeable healthcare provider who can guide you through the process, especially since it requires a prescription and is typically compounded at specialized pharmacies. It's not a one-size-fits-all approach, but for many people it offers a safe, relatively low-cost, well-tolerated, and effective option for managing chronic pain. Thanks for watching. If you have any questions or experiences with LDN, drop them in the comments below. I'd love to hear your thoughts, and as always, please like and subscribe to stay informed, and take care.